Hello, my name is Benjamin Bale. I'm a graduate student in the MBA program at Western Kentucky University studying data analytics. Today, I would like to talk about the COVID-19 pandemic in the United States. I will briefly examine the evolution of the virus and then present a couple of testable hypotheses using data made available by the Johns Hopkins University and present it using Tableau software. First, I would like to make a quick disclaimer. I am not a doctor. Nothing I have presented here is meant to discourage the use of common sense approaches to slowing the spread of the SARS-CoV-2 virus, which causes COVID-19. Widespread adoption of these practices has likely heavily influenced the data I have examined to test the hypotheses that follow. As a quick reminder, here are some of the best practices the Center for Disease Control has recommended for protecting yourself and others from the virus that causes COVID-19. Frequently wash your hands or use hand sanitizer when you can't. Practice social distancing and/or avoid crowded spaces. Wear a cloth mask over your mouth and nose in public. Clean and disinfect frequently touched surfaces often. Be alert for symptoms and do not delay seeking medical advice if you think you may be sick, and avoid contact with people if you have been diagnosed with COVID-19. Now that we've gotten that out of the way, let's take a look at how the pandemic has affected the United States. This slide shows the total number of reported infections and the number of people who have died as a result of being infected with COVID-19. As of August 6, 2020, almost 4,900,000 people had tested positive for the virus in the United States. Among those, over 159,000 had died. To put that into perspective, only 116,500 Americans died in all of World War I, and over half of those were due to disease. I would also like to point out that many states began reopening between mid-May and June, and here we find a possible inflection point near mid-June where the number of reported cases begins to increase. Here I've created a map animating the weekly history of the pandemic in the United States. The states are colored in shades from green to yellow as the weekly number of reported infections increases from 0 to 5,000, and I've placed a dot on each state that changes from yellow to red as the weekly reported deaths increase from 0 to 1,000, and the dot grows in size as those reported deaths increase from 0 to 5,000. As you can see, things were relatively quiet until about mid-March when cases began to appear in large numbers in the northeastern United States, especially around New York. The virus quickly spread across the U.S., briefly slowing around May, before accelerating again into the summer months with large recent flare-ups, particularly in California, Texas, and Florida, bringing us to where we are today. Now that we have a sense of where we are, I'd like to examine my first hypothesis, which is that warmer weather in the U.S. would cause COVID-19 to dissipate like a seasonal flu. I chose this hypothesis because it was a popular talking point during the spring, and now, with most of the summer behind us, the timing was ideal to examine the data to see if this was in fact the case. To test this hypothesis, I compared weekly infection rates for cases of COVID-19 during the late spring with infection rates during the summer months. Here I've displayed the weekly reported infections and deaths in a bar graph. We can clearly see that during the late spring, infection rates generally declined from about 220,000 in early April to about 147,000 in late May. However, reported infections rapidly grew over the summer, peaking at over 467,000 in mid-July. This clearly illustrates that the hypothesis that the summer months would stop the spread of COVID-19 were in fact false. After seeing that the rate of infections had indeed grown so dramatically, I began to wonder if all these cases might have given our healthcare professionals enough experience and expertise with the disease to improve their ability to treat COVID-19 in the U.S. To answer that, I decided to test the hypothesis that our ability to survive the pandemic was improving over time, so I examined changes in the weekly mortality rates for cases of COVID-19 over the history of the pandemic. Here I've displayed that data as a line graph comparing weekly reported mortality rates over time by dividing the number of deaths reported during a particular week by the total number of new cases reported during the same week. First, though, I'd like to address the obvious anomaly during the month of February. This was early during the pandemic, and reporting was still being normalized. I think it is highly likely that this spike was a result of multiple weeks being reported all at once. The rest of the data is, in my opinion, much more reliable. Aside from the February anomaly, it's clear that the mortality reached a peak during May, with nearly 6% of cases resulting in a death. This figure has been decreasing over the summer months, and on August 2nd, the mortality rate had declined to 3.29%. Regarding my hypothesis, I would say yes, our doctors are getting better at helping us survive the infection. However, it is important to note that the slope of the line has been leveling off, perhaps approaching a lower limit for the mortality rate, or even increasing again. Here I've made a dashboard to illustrate my findings. We can animate the map to display how the pandemic has evolved over time in the United States. Alternatively, we can click on any of the weekly bar graph to see the data for that week in the other visualizations. For example, when I click on the bar for July 19th, we can see what the state of infections were on the map across the United States and quickly see that the mortality rate was 3.59%. So, in conclusion, after examining the data, I believe it's important that we all continue to be diligent to contain this pandemic. We must continue to practice social distancing, mask wearing, and good hand washing practices. Together we can make the world a safer place to study, work, and play again. Thank you for your time.